So again, this typical presentation of nodular basal cell carcinoma. Also, the primary modality for this is just excision and closure. Basal cell carcinoma and squamous cell carcinoma associated with ultraviolet light exposure. And there are major two types of ultraviolet, A and B. And sometimes on the sunscreen you can see, okay, it protects from A, protects from B, or A is more aggressive than B. Doesn't really matter. All ultraviolet type lights are aggressive, and you have to protect your body from that. So melanoma. As I said, it's you grade it by the depth. Unfortunately, incidence of melanoma growing every year by 5% on average, and melanoma is getting younger. When young girls want to be beautiful and they go to tanning salons, it's not good. You know, and it was proven. And medical society is fighting with manufacturers of those tanning machines because we have solid evidence that this artificial tanning, if you do it more than 10 times a year, it increases the risk of melanoma by 7-fold. And it's pretty significant risk factor. And you can see, again, the typical presentations, that's how melanoma starts. And in terms of early detection, we go by simply ABCDs. First name, asymmetry. It's never round, it's never square, it's never triangular. It's always irregular borders and with different colors. Definitely, you can find a melanoma with a single color, but majority of times, or if you see your mole or something changing color, it has two different colors, it's something to pay attention to. It needs to be checked out. Also, if, for example, you have a mole and recently you've noticed that it increased diameter, you know, especially goes to more than 1 centimeter, which is something like half of an inch, it's definitely need to be checked out. Depth, very important thing. When you go to dermatologist and dermatologist says, okay, I'm worried that it's possibly something, possibly melanoma. Dermatologists very much like to do so-called shave biopsies or curettage, like scrape, 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 or do a little bit of blade. We always talk to them, advocate, and ask them to do so-called punch biopsy. Punch biopsy, it's a really round blade, goes through the skin, through the whole skin. So it gives a possibility to analyze it and see the depth, because depth is very important with melanoma. If we're talking about superficial spreading melanoma, it's not a big deal. You know, you excise it, well, it's kind of a big deal, but compared to different types, it's, you excise it with 1 centimeter margin, close it, and just follow. Don't do anything drastic. But if you see melanoma which is 4 millimeter in depth, it's very, very serious diagnosis. Because it can be a pea size, but if it's 4 millimeter in depth, it's very serious. It needs to be excised with like 1 inch margins around it. And we always talk about evaluation of lymph nodes, so-called sentinel node biopsy, possibly neck dissections. Because with superficial melanomas, survival is about 90%. And we always grade survival 5-year survival, because studies were done like that. It's not like you live 5 years and then die. It's just scientific term. But if you have a 4 millimeter melanoma, we're talking about 15 to 20% survival. So it's very, very important to know the depth, to do the proper thing. So if you know somebody who has something like that and they go to dermatologist, insist on doing punch biopsy instead of a shave biopsy. So prevention of all this squamous cell, basal cell, melanoma, it's kind of hard because majority of the time or during our life, we get majority of the damage to our skin in the childhood. It's early childhood sun exposure and sunburns, that's what makes damage to our skin. And it lasts through our life. And then when our regenerative abilities or DNA maintaining ability is going down because not enough protein, our health is not good, our immune system goes down, that's when everything starts popping out. It's not about what I've done yesterday. It's what's been done during whole life. And that's why to prevent it, you kind of need to think about that right from the beginning with your kids, with your grandkids. With us, or who's got some damage already, we just need to be aware of this stuff and need to kind of check our skin on a regular basis. Definitely, it doesn't mean that we can go out in the sun and get 20 tents a day from that machine. We still need to protect ourselves, because more damage from the sun, more possibility of developing something bad in our skin. So, caution about protective value of sunscreens. You know, SPF 30, SPF 50, everything is good, but the best protection is not to expose. You know, put bunch of clothes, put hats, long sleeves, you know, everything what's possible to protect your body from the skin, from the sun. Being, for example, on the beach under the shade doesn't really mean anything, because ultraviolet attacks your body even if you're in the shade. So you just need to closely protect your body. Cover it as much as you can. Head and neck cancer, when we talk about that, it's skin, pretty much everything except the brain, including salivary glands and thyroid, and as I mentioned. But we won't really talk about that this evening. The most common head and neck cancer is oral cancer and squamous cell carcinoma. Remember that name, that's the most common cancer in head and neck area. Definitely we have mucoepidermoid carcinoma, adenocarcinomas, those are relatively rare. Squamous cell carcinoma is the big evil we are fighting. You know, we've been fighting, we are fighting, we will be fighting. Over 50,000 new cases every year in the United States, more than 11,000 deaths. It's a big evil. When you think about how can we catch it, because every treatment or treatment of every cancer, main thing is early detection. Smaller the cancer, easier it's killed. So if you have any sore throats or sore in the mouth which does not heal and bothers you, it's better to be checked out. Not necessarily every sore in your mouth or on your tongue, on your cheek is a cancer. And I would say in 85 to 90% of cases, it's not going to be the cancer. It can be some after ulcer. It can be some trauma with the teeth or biting your cheek when you're asleep. Anything's possible. But it needs to be checked out. There is a magic 3-week thing. You know, if you have a symptom for 3 weeks or more, it needs to be checked out. Don't let it slide, thinking, well, it will pass, or it will get better, or I'll do some, you know, chicken broth and everything will be fine. It needs to be checked out. Persistent pain in your mouth, or when you swallow and it shoots into your ear. Those type of symptoms you need to pay attention. Again, in 85 to 90% of cases, it's not going to be that, but it needs to be checked out. Difficulty chewing or swallowing or moving your tongue. Changes in your voice for more than 3 weeks, getting hoarse, or my throat is not the same. Remember, if it's getting better, most likely it's not the cancer, because cancer does not have a tendency to get better. There may be a little bit of fluctuation in the symptoms, but usually if cancer comes, it stays there. It does not disappear on its own. All those remedies, some superpower, superhuman abilities to get rid of a cancer, no, it does not work. Tested, checked, does not work. Cancer needs professional attention all the time, and pretty serious attention. Lump in your neck. Lump in your neck, can be because of simple infection, virus, or some hereditary thing, so-called dermoid cyst, but it needs to be checked out. Older you are, more chances lump in your neck is a cancer. So it needs to be serious attention. Usually, what we do with lumps in the neck, we do antibiotics for 7 to 10 days, and then we talk about sticking a needle in there. Because historically, we used to cut into lumps in the neck to make a diagnosis, but it was proven to be very damaging for the person, because in case it's a cancer, it would start blooming in the area of when we cut into. That's why fine needle aspiration biopsy was developed. We use a tiny 25 gauge needles, and we go into the lump, either just feeling it or under the ultrasound guidance, and we take samples of cells from that lump and send it to pathology, and they usually are able to tell you what we're dealing with. Occasionally, they say we're confused, we cannot make a diagnosis, and then we need to continue with excision, but not incision. We cannot cut into the mass. We need to take it out as a whole. Because if you cut into the neck and into the mass, and if it's a cancer, it will start blooming, and usually it's really grave thing to do. So difficulty moving your jaw, swelling or pain, unintentional weight loss, pretty significant. I've met a couple of patients who were happy about weight loss. Unfortunately, it wasn't really good weight loss. So every time you lose your weight, unless you are absolutely sure that it's intentional, because you are doing 10 miles a day, you are on a treadmill, and you do aqua aerobics every day. Unless you are absolutely sure that it's intentional weight loss, it needs to be checked out. Coughing with blood, very serious. Don't let it slide. Majority of the times when people come here to me coughing with blood, especially if they're a little bit older than 65 years old, most of the time we're talking about blood vessel tumors, hemangiomas, breaking vessels, stuff like that. But it needs to be checked out, because it can be very serious symptom of any malignancy in our digestive tract, or in even our lungs. So it needs to be checked out always.